So yes, I was seeing a patient for back issues. Started working on the transverse abdominis, which is a deep abdominal muscle. The end of the abdominal muscle actually inserts to the part of the pelvic floor. And so I realized as there were times where we were contracting that muscle and then moving the hips, it was just very painful or just uncomfortable for her. Yes. So if they're laying like this, right, with the back on the mat here, it was contracting the transverse abdominis, which is connected all through here, right? And so they're contracting that muscle. And then it was merely just having her tilt her pelvis like this. And as she was tilting the pelvis like that, we started to add in the pelvic floor with that tilt. And she started describing how it was okay to tilt, but then it was very difficult for her when she brought her pelvis back down to then release the pelvic floor. And so it was difficult to kind of bring it up, but mostly difficult to actually relax it. And so, the more questions I started asking about the pelvic floor and involving the pelvic floor in our exercises, I eventually got around to asking her, do you have pain when you're having sex? And the answer was yes. There was pain when she was having sex. What we have going on down here, we have possible surgeries. When we say trauma, that could mean surgeries, childbirth. When we talk about abuse victims who have been sexually abused, they can experience pain coupled with the anxiety, and issues and psychological issues that come along with that. Also, we have where maybe young girls who are getting their periods and learning to use tampons, and they're really nervous about it because that's something new and different, and they don't like it. And so they don't ever want to insert anything up there vaginally. And so then they tend to keep it kind of tense and tight, and they associate like negative feelings towards it. So it's not necessarily like with sex, when you're having sex, that it can be coupled with dryness. Sometimes it really, or back pain or hip pain. Sometimes it can be just literally vaginally. However, if it goes a long period of time, it can then start to leak into the back and present pain into the hips. And that's called, those are like usually radiation, right? Like not radiation, but radiating pain. And we definitely want to get to where we're centralizing it or that we're treating it as a whole. Another part of treatment might be getting some counseling if it's due to any kind of trauma or anything that you've had before. If it's from perineal stretching, or when a woman has a baby, sometimes the perineum tears, and you might need to learn how to massage that scar and get that scar to stop being so sensitive. There is definitely pelvic floor health. So learning to do Kegels and learning how to do them correctly. In that pelvic floor, you have 3 layers of muscles. So like I said, depending on how far that penetration goes and where the pain is at, will definitely let your provider know, like, oh, it's that first level or second level or third level. But definitely pelvic floor in a sense of doing those Kegels are a huge help, as well as usage of biofeedback machines. So they're things that they can insert inside and kind of and ask you to Kegel, right? You're contracting, but also if they insert it and it already is automatically showing you're Kegeling, then it might say, okay, relax, right? So it's going to give you feedback both in the contraction and the relaxation aspect of it. So definitely some exercises with it, with the hips as well, because if you think about it, I'm going to grab my little pelvis here again. You have these hip bones that are right here. And okay, the hip bones that are kind of right here on the corners, right on the either side. And that pelvic floor is connected to some of that, and then inside that pelvis. And if those hips are weak, then what's going to happen is is the hips are going to kind of cave in and that pelvic floor will drop a little bit with that pelvis. And then if we get them strengthened to where they can come back out, then it's going to pull that pelvic floor up as well. And so there's a big dynamic. There's a lot going on with this. However, that's what we do. We kind of break it down to make it very simple, and kind of start by just building awareness of where those muscles are at and exactly what those muscles do. So that's something you can definitely look at when you're going in to receive treatment for it.